Yeah.
Hey, guys. It's our special edition of The Naked Truth with Dr. Katzen. Happy St. Patrick's Day. They're both wearing green. I'm not. That's kind of what I do.
Ooh, bad.
And
Not
my last name's Kilpatrick, so I probably should be wearing green.
Yes.
But you may not know this, Dr. Katzen, but usually everybody, if people dress up on the show, they don't tell me, so I'm like the one who's not in the Santa's hat or the whatever. So this is appropriate. So I'm here tonight with my partner in crime, Patty. Thanks, Patty.
Hi, everyone. Thanks for joining us tonight. Happy St. Patrick's Day, and thank you for everyone who stuck around for these few minutes while we had a little bit of technical difficulty, but we're ready to get started. It is our honor tonight to, if you haven't joined us before on The Naked Truth, to have Dr. Timothy Katzen. He's a plastic surgeon out of Beverly Hills, California. This is the third time he's been on our show, and he has graciously donated his time tonight to answer your questions, specifically about the area of the abdomen region, as far as abdominoplasty, 360, and everything that goes along with those procedures. He's been a great contributor to anyone who is a part of the weight loss surgery community, or anyone who has lost a massive amount of weight. That is his specialty, although he does everything. And he is also my personal surgeon, my personal plastic surgeon, and I recently had the abdominoplasty on December 1st, 2015. So, Dr. Katzen, we just want to thank you, and we're so excited to have you with us tonight.
Sure, well, thank you for having me.
And can I just say, like, Patty looks more amazing every time I see her.
Yeah.
It's like crazy amazing. So I want to let you guys know we have the Q&A board open if you want to ask questions. We're trying to keep this, unless we have extra time at the end, to stuff relating specifically to the abdomen. That's what we're going to do going forward, is focus on a particular body part. But if we have time left over at the end and you have questions that aren't related to that, we will take them. You can post them in the Q&A, or you can also text me your questions at 714-625-5663. And I'm sorry, my voice a week later is still raspy from the post-Chicago 50th birthday party. But bear with me. So first of all, this was a question that I know that I had going into it, is there's so many different abdominal plastic surgeries. There's 360, tummy tuck. Can you kind of explain all of those and what the difference is between them?
Sure. There are a couple of different terms out there, and there are a couple of different procedures out there. But basically, it boils down to about 3 procedures. Okay. There's the paniculectomy, which by definition removes the pannus. Now, that's that area that hangs over the belt line. And sometimes that's covered by insurance. And by definition, the paniculectomy only gets rid of the pannus. It gets rid of that extra skin, extra fat that hangs over the belt line. By definition, you can't touch the belly button. By definition, you can't do any muscle work. So I rarely perform that surgery. It's not a great surgery. It's a surgery we do for basically debulking the abdomen, and that's about it.
So I have Kaiser, and they will cover something. I'm assuming that's what they would cover.
Probably.
Yeah.
So, you know, if it were me having an abdominal procedure after massive weight loss, I probably would not sign up for the paniculectomy. I think you'll get a much better result having what's called an abdominoplasty, and that leads to the second topic, the abdominoplasty. Abdominoplasty, you can do a lot more, and that's the by far more common procedure that I perform, you know, with the 360 or just as a standalone tummy tuck. I would say I perform that procedure 99.9% of the time compared to the paniculectomy. Paniculectomies I will sometimes do perhaps before a gastric bypass, before a band procedure, to get rid of a lot of the extra weight before the gastric bypass.
And I think there are some people in our community who've lost, have lost a tremendous amount of weight, like 200, 300 pounds, and still have more to go, who sometimes have that removed so that they can have more mobility and exercise more to lose the rest of their weight.
Exactly. So let's talk about the second category, which are the abdominoplasties. Okay, which is the tummy tuck. So a tummy tuck is basically you take your paniculectomy and then you go a little bit further up. You go up to the belly button, you go up to the rib cage. You tighten up the six-pack muscle, the rectus muscle, the muscles in the middle. And I can get rid of, instead of the peniculectomy, which just takes off that hanging skin over the belt line, with the tummy tuck, you can get rid of that skin that starts at the belt line to at least above the belly button, or sometimes even higher. So you can go much higher with the abdominoplasty.
Mm-hmm.
And then when you look at abdominoplasties, there are a couple of different types of abdominoplasties. There's one that's horizontal, that just follows the belt line, if you will. There's another one where I do where it's vertical. It goes from the rib cage down to the pubic region, and I can really suck in the edges. There's a combination where I do that horizontal one and that vertical one. That's the T, abdominoplasty. Some people do a fleur-de-lis, which by definition is more of an X, which crosses at the belly button. Not a really great surgery. The scars aren't that great, and I can do a much better job, I feel, with a tummy tuck or a body lift. And then the other procedure we do sometimes with a tummy tuck is I'll make an incision underneath the breast, and instead of pulling the tummy down, I'll pull it up. Okay? Those are reserved for patients that have had a tummy tuck before, or maybe for a variety of reasons because of scars on the belly, I'll pull the tummy up. Okay, so those are the different types of tummy tucks. Then we convert to the bigger procedure, the 360 body lift. And that's if you take a tummy tuck and extend it around the hips, and it extends around to the backside and meets in the back, actually. So it goes 360 degrees all the way around, circumferentially around your body. Some people call it a belt abdominoplasty. Just a little confusing, but if you think of a belt, which does go all the way around you, that's the incision line. So it's not really an abdominoplasty, it's more of a belt procedure, or some people call it a belt lipectomy, where we cut out fat and skin. So those are basically three types. You got peniculectomy, abdominoplasty, and 360.
Now, is there one that it's like an extended tummy tuck where you go like a little bit further around the back, but not 360?
Yeah. So that's a variant of a type of abdominoplasty or a tummy tuck. And extended means you just go a little bit further. Okay. So with the tummy tucks, we like to try to keep the incisions as small as possible with, still getting a very good result. Okay. Sometimes the scars are smaller, and they just go from the inside of the hip, the pelvic bone, to the center. Sometimes we have to go out beyond the pelvic border or the pelvic rim, and that's an extended tummy tuck. A lot of surgeons call an extended tummy tuck when you're laying flat on the operating room table. We go from one side of the table all the way around the front to the other side of the table. So some people call that an extended tummy tuck. Yeah.
Dr. Katzen, how do you decide what the right
procedure is, I think?
Yes.
Yeah, you froze up a little bit, Patty.
Okay. How do you decide which procedure is the right one for the individual?
Yeah, that I leave up to the patient. And that in my questionnaire, I ask the patient what bothers them the most. Does your tummy bother you? Usually yes. Do your hips bother you? Well, sometimes yes or no. Does the buttock bother you? Now, if the hips bother the patient and or the buttocks bother the patient, then we really need to convert to that 360 body lift. But I do have a fair number of patients who are like, my butt's okay and my hips are okay. My tummy is really the thing that bothers me. So we just do a tummy tuck. Me, fortunately, I just deal with what bothers patients. I don't push for surgery that patients may or may not necessarily need or want.
Patty, do you mind sharing what you had?
Yes, I have the extended abdominoplasty with muscle repair. I also had liposuction of my upper thighs. I had breast augmentation and a breast lift. And Dr. Katzen, while performing my abdominoplasty, found a hernia and repaired that for me, thankfully.
Yep, surprise, surprise. Yeah.
And my plan when I get ready to move forward with Dr. Katzen is to do a tummy tuck as well, not a 360. So.
Yeah. So I leave it up to the patient to decide, what bothers them. And then also, we're all realistic. It's also about finances, too.
I just have one. Jenny, VSG Jenny, or VS Jenny from Australia is watching, and she had a question. She had a question related to this, and she says that, Patty, she says that we look gorgeous.
Aww.
And that she's looking forward to hearing Dr. Katzen, but she wanted to know if you've ever done a 360 body lift or abdominoplasty on someone who has lost more than 300 pounds, and is it more complicated or risky?
Sure. My record has been, I've had 2 patients who are over 1,000 pounds. So with that, they had lost 1,000 pounds. So there was one gentleman who they never really knew his initial weight, because the only way they could measure him is they put him in the back of sadly, a pickup truck and took him to a weighing truck station. That's the only way they could get an accurate weight on him before his gastric bypass. So he had lost about 800 pounds by the time he saw me. Okay. The surgery is relatively straightforward, whether it's a 100-pound weight loss or an 800-pound weight loss, because I'm dealing with the waist, and typically 95% of the time you can get a very good result by just doing the 360. You don't need to make that vertical incision from the rib cage down to the pubic region. So in terms of weight loss, it doesn't make it that much more complicated, no.
And what about results? Are results different depending on how much you've lost?
Not really. Results should be just as spectacular. You know, the least weight gained and the most weight lost will give you the best results, of course. But, you know, if you've gained a lot of weight, but also then lost a lot of weight too, you should be able to get very good results too.
Awesome.
Do you want
oh, go ahead, sorry.
I was going to say, for a point of reference, my weight loss was 195 pounds, and in surgery, between liposuction and skin removal with my abdominoplasty was 10.5 pounds total removed of excess skin and fat. So it's pretty great.
Okay.
And great.
Patty, I was looking, I was looking at Patty. I was looking at that picture of us where we were having champagne at your fashion show, and the difference in you is just freaking amazing. You should go back at that picture, which is already gorgeous. You should go back and look at it. It's incredible, the difference. But anyway, so
I'd like to see a copy if I could.
Oh, I will. We'll email it to you. Yeah, I mean, it's huge.
All right, cool.
And then she was already, I mean, that was right before she had surgery, but still, it's huge. So are there things that people can do before, when they're losing weight, to minimize the excess skin, or to, you know, prepare to make them a better candidate as they're going through the weight loss process?
Sure. I think eating right, of course, is very essential. And then exercise, getting a routine exercise program. And then whatever surgery you've had, or maybe even non-surgery, just diet and exercise, your body will plateau. And your body, you'll be exercising hours and hours every day and not eating anything, or eating really, really well, but very concentrated protein. And the body will plateau. And that's when you're probably ready for plastic surgery. And then after the plastic surgery, I think it's very, very important to continue with the protein. You're not going to feel like exercising, and in fact, I don't want you to exercise, but at least you got to continue with that high protein diet, about 100 grams a day, for about, depending on the type of procedure, maybe 3 or 4 or 5 weeks to keep that 100 grams of protein, because your body needs all that protein and energy to heal.
Right.
Yeah.
How long does a person need to be at their goal weight before having plastic surgery?
Or plateau weight. I mean, if it's not goal, you know, plateau weight. Yeah.
Yeah. The goal question. All right. So a lot of doctors, I think a lot of smart doctors that are in this field that realize the goal weight is a nice number and a nice idea, but a lot of the time it's very unrealistic. So I think what most experienced surgeons, plastic surgeons that deal with plastic surgery, reconstructive surgery after weight loss realize is the goal is nice, but your body is going to plateau at what number it wants to be. So you can be exercising 8-10 hours a day and eating, you know, 100, 150 grams of protein, and your body is not going to lose any more weight. So goal is nice, but I don't hold patients by their goal. I look at more their lifestyle. Are you exercising? Are you eating right? If you're doing those two things and your weight is pretty stable, that's when you're ready for plastic surgery, not some number on a scale.
And do you then suggest that they maintain that? Because, like, I went to you and said,
yes,
if I'm doing everything I'm supposed to do, I'm still losing weight. I mean, you said it, if you're exercising all the time, if you're eating exactly right. So I've plateaued a bit lately, but it's because I'm not doing everything I'm supposed to do.
Okay.
So I think that's one of the keys. But once you get to that plateau, when you're doing everything you're supposed to do, how long should you be there?
I like for you to be there for about 3 months. So if you're there for about 3 months and you're plateauing, you're eating right, you're exercising right, and your body has plateaued, if you're at that plateau for about 3 months, then I think you're ready for plastic surgery. And if you've had a surgical procedure, you've given that procedure enough time to work. So for the lap band, I typically give you about 20 to 22 months after your lap band to have the lap band do its magic. After a vertical gastric sleeve or a Roux-en-Y, we typically leave you at about 10 months to a year. And there's also another.
Except for those of us who had a really lot of weight to lose.
Well, no. Usually, a lot of the weight can be lost in those first 10 to 12 months with the gastric sleeve, the Roux-en-Y. Another procedure that's just come out has been the balloon. And with those, it's a pretty cool procedure. They insert a balloon into the stomach, they inflate it, and patients lose weight because the volume of the stomach's been decreased. For those patients also, they typically lose most of their weight in the first 10 to 14 months. So I let the procedures do their magic, and then if you're eating right, exercising right, and you're plateaued for 3 months, then you're ready.
Maybe I'm ready then. So I wanted to let you guys know who else is watching. Sister Scaleback is watching from Canada. She says, thanks for all the great information, Dr. Katzen. I wish I lived near you, but alas, I'm from Canada. Still love hearing great educational information and hope to meet you in Nashville.
Sounds good. I have a lot of patients from Canada. They come down. It's nice and warm in California.
That's right. And if you guys want to go back and look, we did the last show we did with Dr. Katzen was all about traveling for plastic surgery. But I know that she watched that show. So
good.
And I think we sort of touched on this already, where the question was, are there times when people would have surgery when they still have a considerable amount of weight to lose?
Yes. And those patients we need to be very careful of. And I got to make sure that they're eating the right stuff and they're on a strict exercise program. And sometimes those patients I deal with, I think, reality a lot of the time. Some patients will come to the office and they'll say, look, I've lost 150 pounds with this Roux-en-Y, and I'm still off my goal by about 50, 60 pounds. I just can't get there because my tummy is touching the middle of my thighs. Not my knees, not my groin, the middle of your thighs. So I get it. Those patients need tummy tuck so they can exercise better, so they can perform better. And then perhaps maybe they might need to come back later and get a touch-up tummy tuck. But in my experience, 16 years, that is very rare. That maybe 5% of the time, those types of patients need to come up for a touch-up tummy tuck.
And Dr. Katzen, I know you mentioned protein prior to surgery and post-surgery, but is there a vitamin regimen or any other nutrition recommendations that you have for preparing for surgery?
Very good question. So the protein is the most essential thing that you just got to get in as building blocks and helps you heal. The vitamins are also essential. I would suggest a multivitamin or Flintstone vitamins to get that in. Vitamin B12 is very important. We initiate that. We make sure you get your shots before the surgery because that increases absorption and increases energy level. So those are very important. But routine vitamins, also sometimes the antibiotics that you're on after the plastic surgery will wipe out a lot of the GI system. So you may need to get on a probiotic to help regrow that and to also reabsorb some of the essential vitamins.
Okay. So Hopeful T also has a question. She's watching. She said she had what she thought was a paniculectomy with muscle repair. Belly button was moved and was hip to hip. Is that considered a tummy tuck or a paniculectomy?
That's considered a tummy tuck.
Okay,
now,
that's what I thought.
Because they did the paniculectomy, again, just removes skin and fat from just that hanging area. They don't touch the belly button. They don't touch the muscle. But what a lot of HMOs do, Kaiser and other entities like that, is they do the paniculectomy under insurance and then may charge the patient, or should charge the patient, extra for doing the abdominoplasty, the muscle plication, and the belly button. That may be what she's alluding to. Yeah.
Okay. So we usually throw this question in at the end, and I know you're not an insurance expert, but of course everybody wants to know what the cost of these procedures are and if insurance covers. So I thought let's get it out of the way early.
Yeah, good question. And the tummy tucks have been covered by insurance. I have a lot of tummy tucks covered by insurance. The problem is everybody's insurance is so different, and now with the nationalized healthcare, it's even more confusing. So when I see patients in the office, I cannot tell by just examining them if their insurance company will cover their tummy tuck. So if it's reasonable, we will take pictures and submit to the insurance company just to see what's authorized. Sometimes very small tummy tucks are approved. Sometimes very big tummy tucks are not approved. I just can't tell because each insurance company has their own criteria for tummy tucks. And body lifts. I've had body lifts approved by insurance company. I've had body lifts denied by insurance companies. So that's the insurance side of it. In terms of costs really vary by geography, okay, and they really vary by surgeon's experience. The less experienced surgeon may charge less or maybe do it for free just to help patients along. There are also
now I know I'm going to get all kinds of questions about where are those free surgeons, but
yeah, I don't personally. I don't know of any. But
okay, good. So don't send those questions.
They may, yeah. So they may be out there. I just don't know. But also there are also surgeons who are very experienced doing this procedure, and of course logistically they're going to charge more for the procedure. Also geographically. Because my rent is higher and my malpractice is higher because of the place I practice, my rates may be more expensive than other places geographically in the US and geographically in the world too. There are other countries which don't even have medical malpractice, and of course those countries may have procedures which are much less expensive.
Could you maybe provide a range just to give people some idea? Well,
honestly,
I can give my, oh, go ahead, sorry.
Yeah, honestly, I don't know because my office manager quotes those. So I can email those to you and you can post those. But all I can tell you is sort of the range in our area of Southern California. I wouldn't know sort of Middle America or even the Northeast or the Southeast.
Okay, Patty, before you go into, and I mean, I'm happy to tell anybody who emails me what my different quotes were, but everything was combined, so it's hard to know, you know, because I was getting multiple surgeries. But we got a good question come in also from Reality 911. Have you ever refused denied surgery on a WLS patient, and what would have been the criteria for that denial?
Oh, very, very good question. Denied surgery. I'm sure I have. There have probably been patients that I denied surgery if they have not lost a significant amount of weight, if it was too soon after the gastric surgery, maybe scars on the abdomen, maybe there were large hernias with a large piece of mesh inside. Those are the main ones that stick out. Things like history of MRSA doesn't make me deny a patient for surgery. History of HIV doesn't, you know, deny a patient surgery. So I think those are the most. If they haven't hit their plateau or significant scars on their abdomen, maybe sometimes also say a person has had gastric bypass, say they've lost a lot of weight, say they've had a 360 body lift in the legs and the breast and the arms, and then they want a revision of the revision of the revision. Okay? Those raise some red flags. And maybe there is or is not a problem there. Now, most of the patients that I deal with, there are real problems. They aren't sort of made up problems, if you will.
Right.
But maybe if there's something that really is bothering the patient and I don't see it as much, there may be a potential for denial there.
Okay. So as far as like getting into the surgical process and the 360 body lift, how does that particular surgery help with a saggy bottom or in the outer thigh area?
The 360 goes all the way around the body. So it starts in the pubic region and then goes all the way around to the backside. So on the tummy portion, I go up and I pull the tummy down, so the tummy is nice and flat. And on the back side, I go down onto the buttocks and pull the buttocks up like a pair of pants, if you will. So all the hanging skin, all the sharp hay on the backside. One of my wonderful patients called them shrinkles on the butt. Okay, that's exactly what they are. The skin is there, but the fat has sort of shrunk, and you get the hanging or curtain-like appearance to the buttock, and those get pulled up, and it's all smoothed out with the 360 body lift. The lateral thighs also. On the lateral thighs, I pull up the lateral thighs just like a pair of pants on a patient, and really can smooth out the contour on the lateral thighs.
So I hear people sometimes talk about tummy tuck with muscle repair, but is it always part of a tummy tuck or a 360 muscle repair?
It should be. Now, by definition, the abdominoplasty should have muscle repair. Okay. And in my patients, again, my patients by far the majority, 99% weight loss patients, 100 pounds or more, 99.9% of the time, I'm doing muscle repair. And I do a 2-layer muscle repair. I bring it together, and then I imbricate it to bring it even tighter. So I was, thinking the other day, have there been patients where I haven't done the muscle repair? Yes, but those are on patients that specifically requested it. Patient recently, maybe about 2 months ago, Dr. Katzen, I do a lot of wrestling, I do a lot of biking, I do a lot of sit-ups. I don't want you to fix my muscle. And his muscle laxity wasn't that bad, lost about 200 pounds, but his muscle laxity wasn't that bad. But he is one of the very few patients where I said, okay, I suggest the muscle repair, but since you don't want it, we won't do it. But it's usually rare that we don't fix the muscle in my practice.
How does the muscle repair impact the healing process versus not having the muscle repair at all? Or
doesn't really affect it that much one way or the other. I think with the muscle repair, it feels tighter. And the reason I do it is with weight gain, the muscle gets stretched out. With pregnancy, it gets stretched out. So you're bringing the muscle together and imbricating and inverting it. And I think it leads to a much flatter tummy. And I think it leads to a tighter tummy, especially in terms of feeling, for years down the road. I mean, I've seen some patients 15 years out from their tummies and their 360 body lifts, and I ask them, tummy feel pretty tight? Yep, still tight 15 years later. So it's good.
How tight does your tummy feel, Patty?
It feels really nice and tight.
Good. Good. Success.
Good. For sure. So as far as the pubic region goes and the excess skin there, is that something that you handle during a tummy tuck, or is that combined with another procedure?
Yeah, I get asked this all the time. In fact, today I got asked this twice. The area that we're talking about is the pubic region. In the female, we call it the mons, M-O-N-S. In the male, it's the pubic region. I take care of that area when I do the tummy tuck or the body lift. And it really depends on where you place your incision, where you place your scar. If you place your scar high, like above maybe a C-section or where that crease naturally is in the human body, if you put the incision there, you're not going to affect the pubic region in the men or women. So you really need to bring, in massive weight loss patients, you really need to bring that incision low down, okay? And I remove, depending on the patient, sometimes half that hair-bearing pubic region, sometimes even more, okay? On some of the more extreme cases, I have to carry that incision down onto the pubic region. Instead of being a horizontal incision, which follows the belt line, I bring the incision this way, down into the pubic region, and resect more. And that can be done at the same time as the body lift or the tummy tuck. It does not have to be done at a separate time. It should
Is it a separate procedure? Is it a separate procedure, or it's just sort of?
For me, it's part of the tummy tuck or part of the body lift.
When you, Amy, who went with me for my consultation, we call it your magic mirror. But your magic mirror, you showed me what that would be as part of it, and it was amazing. Yeah. Yeah, and that was just seemed like it was part of what we were already talking about.
Yeah, it should be part of it. I know board-certified plastic surgeons that don't address that with their tummy tuck, and then the patients come to me for revisions, you know, specifically of the pubic region. And It can be a significant problem if the tummy is nice and flat, and then you put on a pair of jeans and the pubic region is not, and then we need to revise that. So not too difficult to revise, but should be done with the tummy tuck or the body lift.
I'm kind of throwing this in there, but does it almost lift the pubic region or, you know, the vaginal region on a woman?
And yes. So with weight gain, the pubic region actually falls underneath the body. The external structures and some of the internal structures fall underneath the body, okay, on men and women. So on the pubic lifts, as part of the tummy tuck or the body lift, that whole area is pulled up on men and women. So for women, sometimes when they urinate, the direction will be different, okay? Same thing with men. The direction of urination will be different. Also with intercourse, it feels different because that whole area has been elevated on male and females. So I get that from a lot of patients, you know, this is all very different. I'm like, yeah, that's because everything has fallen down with weight gain, and now I'm lifting everything up to a more normal position.
Mm-hmm. Very good.
Yeah.
Thank you.
Sure. Before I go into my next question, we have a question from Sister Scaleback who wants to know what's the risk rate of infection and compression syndrome after these abdominal surgeries?
Compression syndrome, I'm not sure about. The risk of infection, very small. I put drains in to minimize any collection of fluid, and while the drains are in, you're on antibiotics. So drains may stay in 1, 2, sometimes 3 weeks, depending on the amount of fluid that your body's making after the procedure. And during that time, you're on antibiotics. But the risk of infection, I would say probably less than 1%. Can happen. It's just like any other surgery. But the risk of infection increases with diabetes and increases with smoking. Now, that's active smoking, and that's active diabetes. A lot of my patients have had diabetes, and with the weight loss, the diabetes is gone. So that is not a risk factor anymore. And fortunately, most of my patients also have quit smoking forever.
Right. So if a patient wants to have liposuction at the same time as their abdominal surgery, is there a limit to how much fat can be suctioned off, or what's the process for that?
Always a very good question. So the limit on outpatient, like you go home the same day, surgery center, is 5 liters. Okay, so 5 liters of fat. If we do it in the hospital, we can do a lot more if we need to, because we can monitor you if we need to while we can do a blood transfusion, though that's pretty rare. But yes, liposuction can be done while we do a tummy tuck, and it can be done while we do a 360 body lift, certainly.
Awesome. Okay. What is the recovery time post-op regimen and follow-up for these procedures?
Sure. Now we have the tummy tuck, and then we have the 360 body lift. And the way I look at it, the tummy tuck addresses the front 1/3, and the body lift really attacks sort of the back 2/3. So if you have a tummy tuck versus the back lift, the tummy tuck really is only 1/3 of the procedure. The body lift entails everything. Tummy tuck, I would suggest if you have a sitting job, take off 2 weeks from work. If you can take off more, 3 days. 3 weeks. For the body lift, I would probably take off minimum 2 weeks. If you can take off 3 or 4 weeks, that'd be great. If you do a lot of lifting, maybe you work at Home Depot or do a lot of lifting of boxes and things like that, from a tummy tuck, maybe take 3 or 4 weeks off. From a body lift, maybe 4 to 6 weeks. Those are on the tummies and the body lifts. Yeah.
How does travel affect that? As far as when can somebody actually go home if they're traveling to come to see you for these?
Sure. With the tummy tuck, you can typically stay, I'd like you in town, Los Angeles, for about 10 to 14 days. With the body lift, maybe about 2 weeks to maybe about 2.5 weeks. I'd like to ideally, make sure you're all healed up before we get you on a plane.
Okay. And Dr. Katzen, how long should somebody wear a compression or binder garment post surgery, and are Spanx okay, or Spanx type of garments okay to wear?
Yeah, a couple of questions involved in that. Basically, how long do we wear the garments for? And that really depends on what procedure we've done. So there's the abdominoplasty, there's the body lift, there's liposuction. typically we like you to wear the garments for 6 to 8 weeks after these types of procedures because there's a lot of swelling, and the garments are good because they minimize swelling. They also help flatten the scar. Scars are going to try to come up and erupt and make, speed bumps, if you will. The compression garments really flatten things. So compression garments are your friends. And also, the body swells up just because the drains are in place. So typically I tell patients, wear the garment 6 to 8 weeks after your procedure, but if the drains stay in for an extended period of time, you need to wear the garment for about 4 weeks after the last drain comes out. And that should minimize your swelling. Okay. So you should always wear your garment when you're exercising after your surgery because your body likes to swell up after the surgery during exercise. Spanx, we can do better than Spanx initially. We have surgical compression garments which make it even tighter than Spanx. And then gradually, as you get more out from your surgery, 6 to 8, 10 weeks out, then you can convert to Spanx. But most of my patients like wearing the compression garment. As I said today to another patient, the record has been, I had a patient who wore their garment after their body lift and leg lift for 2 years.
Oh, wow.
Now she was a little compulsive, but you can barely see her scars at all. Did I tell her to wear it for 2 years? No, I told her to wear it for maybe 2 months. But she said, well, I like my garment and I see the results and no harm, no foul, and I only see improvements, so I'm just going to wear it. So she wore it for 2 years.
I find it's personally kind of a security thing for me. But I'm starting to wear it less and less, but definitely always when I exercise. But I definitely have enjoyed my compression garment. I really like, in comparison, Spanx to the post-operative that you provided. That garment is far superior in my opinion. So.
Yeah.
When can someone start doing core exercise post these procedures?
Yeah. Exercise, I would give yourself at least, after a tummy tuck, I'd give yourself at least 2 months before core exercises. For a 360 body lift, maybe at about 3 months. You can do, after a body lift or tummies, you can do arms, and you can do legs if you can isolate the rectus muscle. I really don't want you hitting the rectus muscle for at least 2 months after the tummy tuck. Yeah.
Very good.
So as part of our preparation for weight loss surgery, there's usually a psychological evaluation. I think a lot of us feel like there should be more psychological follow-up post-weight loss surgery. But are you aware of psychological issues that come up post this kind of surgery?
Oh, yes. We see it every day. And you also have to realize that fat is like a sponge, okay, in the fact that it is a great storage for hormones, okay? Estrogen, testosterone, a lot of things that influence mood. So I have seen patients go through huge mood swings right after their surgery. A lot of the time it's related to the sheer fat that I take off. Sometimes it's related to the medication. Sometimes it's related to all of these put together. Sometimes it's I've seen it, fear of being skinny. I mean, I've had patients pretty much completely break down crying, sobbing uncontrollably for hours because they don't know what to do. Literally, they ask me, Dr. Katzen, what do I do now? I go, what do you mean? She goes, well, I'm skinny now. I don't know what to do. What am I supposed to do? I'm like, just do what you normally do. It's no. So it can be pretty scary for some patients. But we get you through that too. But it is definitely an issue, and it definitely is out there.
I mean, I have to tell you, and Patty, I'm talking about my experience related to your results, not your experience. So, but, so I've known Patty, I met Patty, we met in our Kaiser weight loss surgery class. So we knew each other when we were both, fairly significantly overweight and have gone through this process together and have seen her change, and lose almost 200 pounds. But there is something about, I was used to the Patty who had lost 200 pounds, but there is something so different about the Patty that's post-plastic surgery, both in the way she looks and the way she shows up. I mean, it's really incredible, and I would think that would be, pardon my French, a little bit of a mindfuck for people. To go from, even though you've lost all this weight and you're much thinner, but I mean, just the difference is incredible.
Well, thank you. I can attest to what Dr. Katzen was saying about the emotional component. Between weeks 2 and 3, I had a couple of meltdowns that I was just uncontrollably crying for a couple of hours, and I'm sure it was all of the hormones just surging through my body, but I couldn't even explain it. So, but you know, it was short-lived, and thankfully, you know, I'm enjoying the benefits of what's occurred now. So I'm very appreciative. Thanks, Elizabeth, for that nice compliment.
But yeah, I mean, and I want to make sure I'm saying it's in a good way, the way you show up, but it's just so different.
Thank you.
So anyway.
Yeah. Can you talk about recommendations for minimizing scar following surgery? We have somebody in the community who also had tummy tuck, and she has tried all different things because she's had itching. So she's tried histamine blockers, multiple steroid ointments, and prescription compounds, and they're not helping her. And she was just wondering if you had any advice or tips that you would recommend to your patients for itching around the scar area.
Now, it would really depend on how far out she's from the surgery, but I'll answer it in sort of a general term.
What is she, like 6 months, I think, probably?
She had her, I want to say she had her surgery in August or September.
Yeah. Okay.
Okay, so about 6 months. So by now, most of the sutures should have resolved or dissolved, but it really depends on who did the surgery and how they did it and the suture material in there. Perhaps there's a permanent suture in there that's just underneath the skin that's still there and causing some itching and maybe some reaction. So it may be a foreign body in there. Maybe there's mesh in there from a hernia repair. Don't know. So in terms of the itching, itching is a normal response to healing. Basically, it's due to histamine released by the mast cells, which is normal part of healing. Antihistamines are the best first-line thing to go. If you still have itching, antihistamine cream works really well, Benadryl cream. Still have itching, steroid cream, maybe even steroid pills, to the point of maybe we would inject the scar with some steroids. There's some really good numbing cream that we can prescribe, which numbs up anything. We can numb entire areas that we need to do minor procedures in the office. And if it's still hurting after that, I'd probably suggest maybe some laser treatment to it. There's a very good laser called a Fraxel laser or an ND-YAG laser, which will really help get rid of the itching and the scarring from procedures like that. And if really those don't work after about 3 or 4 months, then she may need a little revision in the office. Perhaps her body just doesn't like that area of the scar, and maybe we just numb that area up in the office and cut that portion of the scar out and put it back together, and she heals up. That's what it sounds like.
So this is one of our questions from the audience. Do you ever have people who have a tummy tuck and then come back afterwards and get a 360? Oh,
yes. Yeah. Most of the patients, most of my patients that happens to have a tummy tuck by somebody else. However, I do have a subset of patients, maybe probably less than 5%, who have had a tummy tuck done by me, and then down the road they're like, Dr. Katzen, you were right, now I need a 360 body lift, and we do that. But I have a fair number of patients who come in with the tummy tuck done and do a 360. And typically what I call that is a posterior body lift, okay? Because the front part's already been done. The tummy's been done. A third of it has been done. I just need to connect one anterior hip around the other hip to the back and then come around to the other hip and meet it around. So I've got to do about 65–70% of the circumference of the body to get that posterior body lift, which addresses the lateral thighs and the buttocks. Yeah, but just because you have a tummy tuck doesn't mean you can't have a 360. Yeah. So we get
is there a difference in results if they would have had the 360 just to begin with?
Yeah,
I think it's better.
Yeah, I think you get a better result by doing the 360 initially. Why? Mm-hmm. Well, the obvious is one recovery, one anesthetic, one time off from work. The other one is, if we do a tummy tuck, at the edge of the body lift, when I do the posterior body lift, as I come around the hip, there's always a dog ear. So I've got to keep chasing that dog ear more and more towards the front. So when we do posterior body lifts or the completion of a 360 body lift to someone that's already had a tummy tuck, the original tummy tuck scar that I leave usually is about maybe that big, which is about 6 inches.
Can you explain what a dog? Can you explain what a dog ear is, just to people who may not know?
Yeah, when you're bringing tissue together, and there's a moderate amount of a tissue, at the edge of the scar, there's a lot of extra tissue left over. So there's a lot of extra skin and fat at the edge of the incision. So the tummy tuck incision can look perfect, but right at the edges, you get these things which sort of look like dog ears. I wish they thought of a better name for it. It doesn't really look like a dog ear at all. But I guess with extreme, to me, it looks more like a shark fin, if you will. It sort of sticks up like that, and you get a little dent like that. And that's at the edge of the incision. So the only way to really get rid of that is you keep, what I'd say, chasing the dog ear. That means you keep on extending the incision, extending it to get rid of that dog ear. And that's how the body lift came about. Because we did tummy tucks, and we kept chasing the dog ear, and that converted to an extended tummy tuck, and then we're like, whoa, we still have dog ears on the hips. Okay, flip the patient over, chase this dog ear. So we chased it all the way around till it met in the back, and then we're like, look, no more dog ears. And then we're like, oh, look, we just went all the way around the patient. And that's one of the beauties, too, of the body lift, because there is no end to the incision. It's just one ring that goes around, and there are no dog ears.
Gotcha.
Okay.
Yep.
As far as abdominoplasty goes, or any of the abdominal surgery, one of the viewers was asking about revisions and what the percentage is of revisions that occur, and what might be necessary, and are they something where you have to go back for surgery, or can they be done in the office?
Very, very good question. So, question is revisions. In my practice, extremely low. From the body lifts, revisions of the body lift have to be less than probably 2%. Extremely low revision rate. Revisions from tummy tucks, extremely low again. Probably maybe less than, probably 3% in terms of the tummy tucks. Most revisions can be done in the office. Basically, we numb up the skin, we inject the skin, it's completely numb, and we do a little revision in the office. Very rarely do we have to go to the operating room to do revisions of tummy tucks or body lifts. But yeah, it does happen. It depends on your surgeon as to what can be done in the office and what needs to be done in the operating room. It really depends on the comfort level of your surgeon and the comfort level of the patient. Okay? If I have a patient that's really very nervous and passes out even thinking about surgery, we'll probably lean towards the operating room. But if I get a patient that's, yeah, we can do this, you know, we give them a little Valium, we inject the area, we numb up the area, and we can do little touch-ups in the office. In terms of charging for revisions, that's really up to the surgeon, you know, if he decides to charge or not, and if there is a real problem. Now, when I say problem, some patients will come to the office and they perceive there might be a problem when there may not be. And that's sort of at the discretion of the patient and the doctor to sort of decide, you know, is that really a problem? Do we really need to numb that up and do that in the office? Or, yeah, there's a dog ear and that really needs to be fixed. So that's more of a individual patient-physician kind of thing to decide.
What are those types of revisions as far as it's time? I can't even imagine what that would be, so I'm just curious.
Yeah, perhaps maybe there's a thickened scar, maybe a little bit of a speed bump scar. Perhaps one area, sometimes when we do the tummy tucks, everything gets pulled down nice and tightly and everything is nice and flat. And then maybe 6 months later, some of the skin may be tighter on one side and loosen up on the other side. So we numb up that area in the office and tighten up that other area. I've seen that sometimes. Sometimes the pubic region, the mons region, I'll take out 50, 60, 70% of the mons region, and then maybe 6 or 8 months later, because of the elasticity of the massive weight loss patients, the skin stretches out, and I got to come back and revise the mons. I've seen that on 1 or 2 occasions too. So those are the type of revisions that we do in the office, more of scar stuff or skin elasticity things. Yeah.
Okay.
I have like one more question. Do you have it's 8 o'clock and I want to be really respectful of your time. Do you have a minute for one more question?
Sure, absolutely, sure.
Okay, so, and we ask this every time, but I think it's important because we have new viewers every time, and I think this is something that applies across the board to everybody. Can you give us real quickly your suggestions about how to find a good qualified plastic surgeon?
Well, if I were in another person's shoes after weight loss, if you're thinking about plastic surgery, I would choose a plastic surgeon. Seems pretty obvious, but in the U.S., any MD can, in their surgery center, can almost do anything they want. That means in the state of California, we have dermatologists, we have OBGYNs, we have oral surgeons doing all kinds of things in their surgery center. Is it illegal? No, it's legal, but a lot of patients sort of get sucked into that, and they think just because a doctor has an MD on the wall, they're qualified to do the procedures. So if I were you, if you're thinking about plastic surgery, make sure your surgeon is a board-certified plastic surgeon. There are a lot of plastic surgery boards out there. There's a ENT, ear, nose, and throat doctor, plastic surgery board. There's a cosmetic surgery board where any MD can do a fellowship for a couple of years, and then they're a cosmetic surgeon. Now for me, I did my general surgery training. I did my plastic surgery training. I did 3 fellowships after that. So that was 9 years of plastic surgery training. So the best place to go is plasticsurgery.org. That's the only medical specialty certified by the American Board of Plastic Surgery to determine if your selected surgeon is a board-certified plastic surgeon. So plasticsurgery.org to find if your surgeon's a plastic surgeon. Then I would go on the internet, go to that physician's website, and make sure you see pictures of weight loss patients. You don't want to see 100 tummy tucks or 100 breast augmentations or 100 medial thigh lifts on non-weight loss patients. You want to see weight loss patients. And if they don't have pictures, I'm sorry, they either don't have the patients or maybe they don't have their pictures organized. But, you know, I've written articles and given lectures. I would say a good number is they should have 50 pictures of patients just like you seeking the procedure you want. So if you're looking for a body lift, you should have minimum of 50 different patients, that procedure on their website. Looking for a thigh lift, 50 massive weight loss patients different on their website. You come to their office, you know, we've got books and books. You want more pictures? We've got hundreds of pictures. So number one, they should be certified, American Board of Plastic Surgery. And number two, they've got to have a lot of experience. Good question.
Great.
Can I just add to that, too? As far as a patient perspective, there's a website out there called Real Talk, and it's a great website where people go on and they actually review plastic surgeons, and you can read review after review after review. And I completely appreciate Dr. Katzen and respect him. He has been the most excellent plastic surgeon I could have ever imagined having, and we just want to thank you. We know you're going to be in Nashville at the WLSFA,
yeah.
and you'll be doing consultations there, and we're thrilled about that. Dr. Katzen gives so much of his time to the organization. But in addition to that, you also do Skype consultations and consultations in your office. If somebody wants more information and wants to schedule a consultation with you, what's the best way for them to get in touch with you?
Sure. You can just go online and type in Timothy Katzen, T-I-M-O-T-H-Y, Katzen, that's K-A-T-Z-E-N, MD.com, and my website will come up. And then from there you can get Skype information, you can get my office number, you can get my email, contact the office, and then we can set up Skype consult if you wish, FaceTime if you wish, face-to-face consults. I can see you in Nashville, whatever you wish.
Great. Well, thank you so much, Dr. Katzen. I really appreciate you taking the time to come on. Next time Dr. Katzen's on, we're going to be talking about breasts, so get your questions ready. And
male and female.
Oh,
male and female, yeah.
I meant to ask about males as it related to, I'm going to ask it really quick. Is there any difference for men having the abdominal surgeries than women?
Two main differences. On the males, the male anatomy in the pubic region turns into the letter W, okay? In the middle is the shaft of the penis, but on each side, that's where the excess skin goes down. So on the males, it looks more like a W. On the females, it just comes down as a U. So on the males, I make my incision like that, but the final incision rests pretty low. Male or female, all the nerves down there are completely intact. That's not an issue. All the nerves are completely intact. And the second difference on the males, tummy tuck and the body lifts, females, I give nice, skinny, vertical, up and down belly buttons. Okay? Those female belly buttons on males look ridiculous. So on the males, I give males a nice round male belly button. So those are really the only two main differences.
Okay,
yeah.
Great. Thank you for saying that, because I meant to ask that question. I forgot.
Another very cool thing that we do too is after the tummy tuck or after the body lift, when everything's healed, we can go back in and do liposuction sculpting on top of the abdomen to make it even more contoured. So on some massive weight loss patients, they've had tummy tuck done by somebody else or me sometimes, and then I'll come back 6 months later and actually sculpt out a six-pack on their abdomen. And here you have patients, here you have patients that have, lost 200-300 pounds, and now they have sculpted out six-packs on their tummy. Pretty cool.
I'm going to throw in one more male question, and you may not have any resources to this, but we have someone in our community who's lost a tremendous amount of weight and works out like a fiend. His name is Pete. He lives in Canada and is trying to get approved for surgery, having difficulty. Do you know any resources that might fund him for plastic surgery in the U.S.? I already checked with WLSFA.
Oh, WLSFA is the best.
Yeah, because he's international.
As far as the resources.
Okay.
Yeah, that's the only resource that I know of. But I would also counsel him to consult with U.S. plastic surgeons, at least to find out the price, so he sort of knows the ballpark. And then maybe even consult with plastic surgeons in Canada to at least see the price differential. I don't know the prices in Canada.
Yeah, I think it has to do with the public. I think it's because it's the way their healthcare there is. I don't remember exactly what his situation is, but he works out like a fiend and looks incredible.
Yeah.
But I know this is something that's really important to him, so I just wanted to throw that in. So on Sunday, we're back with The Naked Truth. We didn't do it last week because we were all in Chicago, but we're going to have a Dr. Katzen fan as our guest on the show next Sunday. That's Banded Wendy. Banded Wendy, who's a patient, who's also a patient of Dr. Katzen's. So tune in on Sunday, and as always, like, share, and subscribe to The Naked Truth. You guys have a great week, and I will see you in a couple days.
Thank you so much, Dr. Katzen. We appreciate it.
Thank you very much.